All right, so we're going to try to do some bonus material here. Maybe I haven't decided exactly how I release it, but I did have one question in regards to things like specific to autoimmune issues. And have you ever seen physical therapy also improve, like, because sometimes we're looking at, you might be encountering somebody and looking at things at wellness in a very, like, all different areas of their life, right?
This wholeness.
Yes. So in connection with physical therapy and diet, of course, because there are a lot of connections with autoimmune stuff and diet. But have you ever seen improvements in someone's that was experiencing an auto, or maybe they, were given an autoimmune diagnosis, and that's going hand in hand with whatever else they're experiencing when they come to see you? Have you ever seen improvements in both, in all areas, I guess?
Absolutely.
Okay.
Because it's not just, let me describe it this way. It's not just how many squats or how many step-ups they do in a set. It's the smile that's now on their face while they're doing it.
Okay.
It is the confidence, they're standing up a little taller. There is, while there's the reality of the autoimmune, flare-ups, people report, the severity and duration of those flare-ups are certainly improving. And again, the exercise, for my part, the exercise is it's a vehicle, but it's a small part of this ultimately.
Yeah.
If I'm doing my job correctly, I want people to be laughing. I want them to have fun. It's not a, Pollyanna kumbaya kind of, feel good session, but let's bring some cheer. Let's bring some joy. Autoimmune can be diagnosed and treated medically and pharmacologically.
Yeah.
But there is subjective context. There's real life wounds, I feel, that are behind it. I believe there are spiritual forces behind people suffering with these things. That is not to say that they are remiss or lacking in spiritual grit, or that this came upon you because you didn't have enough faith. Please hear me. I'm not saying that. But we're not dealing with a battle of flesh and blood. We're dealing with the dark forces and principalities of this dark and fallen world. If we really believe that, is it too much to say that how the body's attacked and how the body learns to attack itself? Is it too much to say that has some spiritual implications as well?
Yeah, absolutely.
I believe absolutely. So, yes, you're affecting and improving upon the autoimmune presentation, I guess, the flare-ups, symptoms improving, the quality of life and function going up. I think when it's all said and done, what is improvement with autoimmune but just a more integrated whole self?
Yeah.
Who is standing up a little taller, confronting or attacking things that they were disinclined to attack or attend to. So in that sense, yes, on the physiological level, but also on the just the whole person level. Absolutely. Yeah. Absolutely. And whatever befalls us, we have a response. Yes. Pray as if it depends on God, but work as if it depends on us. Right. So we are invited to a response. I have these issues, these medical issues. Well, I need to contend with this. I need to deal with this. The last thing I just want to see is people resigned to a fate that perhaps God doesn't have for them. And again, this is not to be confused with health and wealth gospel. You just believe harder and everything is going to be just fine. No, there's that thorn in the side.
Yeah.
Right.
Well, I saw some of that with my lower back, in that, because part of what I would pray for too is wisdom, because I had this understanding that we do have this ability in our body, that's God-given ability in our body for it to heal itself.
That's right.
And so I'd be like, okay, what is there lifestyle things that I'm doing that's blocking that from happening?
Sure.
So I'd be like, Lord, reveal those things.
Search me out. Yeah. Search me out, Lord.
Reveal those things to me. Give me wisdom. Obviously there was a lot to do with diet, and so I felt like, okay, if I'm just going to keep giving myself poison, that's not conducive to receive some type of miraculous healing so that I can keep eating poison.
Sure.
In this junk, junk food and highly processed and a bunch of sugar.
Sure.
That's not, I don't see us being able to speak to the mountain in that way. the way that Jesus told us.
Well said.
So I was still believing that I'm going to speak to this mountain, but I'm also going to get wisdom in how to speak correctly to the mountain.
Well said.
And so I was wondering though too. I'm just curious, like if there's a connection there with autoimmune stuff, because there is this weird thing about the body attacking itself, right? And that doesn't seem to make sense, but that's also connected. That's got to be connected to our central nervous system, right? We just said how the nervous system is what's controlling everything. So if the nervous system is telling to attack this part of the body, is there a physiological component to that on top of also diet and on top of the stress and is there any other trauma they're holding on to and all these things that could be connected?
And the earlier, now don't want to cut you off there. The earlier analogy to pain is it's often a request for change. What is going on? And again, without specific data, you just observe this. There is certainly a strong connection between the autoimmune issues and deep abiding depression and anxiety and hopelessness. Chicken or egg? I don't know. I don't know. Are you depressed because you've been dealing with these issues? Or are you dealing with these bodily sensations because you're depressed, because you're not whole?
And then it's just a cycle that gets worse.
It's a cycle that gets worse.
Whichever one came first, it may not matter once you're in the cycle, because one just kept feeding the other, and now it just keeps getting worse.
But we're not. Gosh, what did C.S. Lewis say? I hope I'm saying this correctly. I believe it's C.S. Lewis. We're not bodies who have a spirit. We are spirit that happens to have a body. Right. So the bottom line is they are. You cannot disentangle the two. You cannot disentangle body and spirit, which again is why I firmly believe, there is a spiritual component. Even in some of what I've explored in various studies that I've done with groups of men in our church. This is called Strongholds for Men and Crossroads.
Okay.
Where week by week you are calling out spirits of these various strongholds that you've made agreements with. There's a guy who's no longer with us. His name is Peb Smith. He was a physician, lived in Texas, and he endeavored to map out to a great degree how this spirit of rejection, for instance, is associated with this physical manifestation. And you often see how that's tied into Scripture too. David said, "When I held in my sin, when I didn't confess my sin, like rotting in my bones, I felt rotting in my bones." And that can be perhaps extrapolated to, okay, maybe he was literally shedding light on how cancer,
experiencing some type of physical manifestation of that,
or heart issues due to fear, where our fears are wearing us out, running us into the ground, whatever the case may be. But there's again, you just can't disentangle the spiritual from the bodily,
right?
And I realize that in physical therapy, there's only so much that the quote profession of physical therapy can do to attack the entirety of what autoimmune, entails. As an example of autoimmune, actually, interesting. Another quote that comes to my mind is actually Carl Jung, a psychiatrist. He said something to the tune of, when you're dealing now, his was psychiatry, but he was treating people, right? After all, he said, when it comes to how you treat people, know the tricks, know the trade, know the techniques, know all the methodologies, but when it comes to dealing with another hurting soul, just be another soul. Just be present to that person. And again, you're not taking on the entirety of there's boundaries with that, of course. You're not embarking on the entire journey that you're taking. You're responsible to others. You're not responsible for them. You're responsible to others, not for them. So everybody has to kind of gird up their loins and take responsibility and seek out the healing. I just hope to facilitate that. And it is the whole person. It is the whole person. We got tricks to bring blood flow to certain areas that need the blood flow, literally, because they're physiologically like acidic in there. They're not getting the blood flow. So we heal the body with oxygen. We heal the body with blood. That's another thing you and I talked about. But other than that, just facilitating an environment of just ease, just at ease, just relax. Let's have fun with this. Let's see what's possible.
Yeah. Well, and like you and I had talked a little bit about, and we haven't focused a ton on it specifically. I think everything we've talked about fits right into that one statement of healing in the blood, right? And that spiritual connection that, the healing in the blood that we have of the blood of Jesus specifically, but it makes perfect sense that God would also have healing. I mean, there's just so many connections of healing in the blood, right? So it all just, that spiritual physical connection, like you said, can't be overstated. It can't be separated.
And I even looked, when I consider what the parables were doing, when Jesus taught in the parables, he was speaking to something that's relatable. Agriculture, you You recognize yield and crops and harvest, and you recognize these concepts and ideas that was all around you. I, for example, this is just an example. I'm thinking about this as I'm doing needling on or deep tissue work on somebody's trigger points or knots that are it's really bound up and wound up by stress. It's been a very persistent, frustrating thing. Frankly, sometimes people will actually shed tears because they have bound up a lot of trauma in these.
Wow.
People will absolutely shed tears on your table.
Wow, just that
absolutely
tension, everything, physical tension,
it's catharsis.
Mental tension, everything's just being released.
It's a cathartic kind of thing. And when I think of physical, I literally have I can only see skin, right? But underneath, I just visualize this is part of somebody's person that became trapped, and it would not let healing in.
Yeah,
literally
bondage.
these areas. Yes, so these areas, these trigger points, these knots, literally and physiologically get a little acidic. They're not getting the blood flow that they need, so that literally changes their physiology. It affects the nerves downstream, and it can radiate pain to different areas of the body. But that's one thing that came to me. That is, you asked earlier, like, do you see God at work in your, like, that's one example. Like, this person let me into their knots, their trigger points. That was vulnerability there.
Yeah,
like, I'm tired of dealing with this. Maybe this can help. And I find myself like praying, like, Lord, I sense that this person is not just stressed, but distressed. If there's anything this treatment can do, would your presence be upon this situation right now? Because we know physiologically what's happening. Physiologically, yes, we're bringing life-giving. We heal the body with oxygen is something I tell our clients. We heal the body with oxygen. We're bringing blood flow to the area. But Lord, would you bring something special to this treatment? I got some tricks, I got some tools, but like the scripture says, some water, some plants, but God is who brings the increase. God is who brings the increase.
That's awesome.
It's like, God, will you do something special with this treatment? And sometimes it's just a wild, wonderful, I just can't stop joyfully laughing. Other times, okay, not yet, not as I expected, but we're gonna keep going. But that concept, I try to keep it top of mind. We heal with the blood. We are healed with the blood. I think about that often.
Yeah, that's awesome. I've got I probably have another like let me ask you this one question, because I'm starting to even just like, I'm just so thankful that God had us be introduced to each other. I mean, this is just
great,
like,
man. It's been wonderful. Appreciate having you.
Yeah, I mean, it's sometimes those moments, where you just see God in something, and you're just like, man, thank you, God, for bringing this man into my life. Like, this is such an awesome connection. I'm so excited to know you, and now and to be able to do this together. And maybe we can, have you on as a periodic regular.
This is not our last time. I believe it, man.
I don't know how much influence. I don't know how much influence you have at Mobility Fit, but hey, this could be the official podcast of Mobility Fit. I'm just saying. I'm just throwing it out there. I got some empty spots here for
July 6th
for some sponsor logos. Okay, I mean, 103 subscribers. Who wouldn't want that kind of
let's go,
that kind of notoriety? Anyways, so the last thing then I'll ask you about in regards to the autoimmune stuff is there ever a situation? Have you ever had this, or could you see this being a situation where someone has been experiencing a lot of autoimmune issues?
Can you give me an example?
Take Crohn's, for example.
Okay.
Are you familiar with what Crohn's is in terms of autoimmune? It's mostly involving the digestive system.
Sure, sure.
And so, but they may not have like a specific physical pain like an athlete that would come see you, or a fall that happened that you got a referral from a general physician because of a fall, or something like that.
Right.
But somebody that hasn't had any other answers, and they come to you, and just like, is there just like a general assessment that you would do on someone for their overall movement ability, their overall, like,
sure.
And you would check, like, okay, let's see how your shoulder moves. Let's see how your hips move. Let's see how your knees move. And then based off of that assessment, not that you're looking to specifically treat Crohn's,
correct?
Right. But you're looking for something that hasn't really manifested itself in the way of knee pain, back pain, shoulder pain, something like that, to where you see these mobility issues. Maybe, I mean, It's called Mobility Fit, right? So you start seeing these you identify, okay, listen, this is a mobility issue. You can only lift your arm up this high. You can only do a squat this far.
Sure.
You can only, twist, your posture's like this,
right?
And then you say, okay, we're going to start attacking all of these things.
Sure.
Is that something that, like, someone could come to Mobility Fit, to your office, not even say, like, I'm looking for a cure for my autoimmune, But like I said, just because there's that connection of that central nervous system,
Sure.
and then you start working on all of these things, and you get them
yeah.
moving better, and you get them mobility stuff, and then they start, and maybe I don't know, they start seeing these improvements in, like you said, in that autoimmune flare-ups and things like that, because now the central nervous system, whatever it might be, working the way that it's supposed to be more working.
Bottom line is, I've seen that, and again, just for the sake of staying in our lane, we are treating, again, in our orthopedic outpatient space, we are treating musculoskeletal dysfunction, and quality of life issues that people have as a result of that. But so, as an example, there's one woman that comes to my mind who, she didn't come in here for her autoimmune. I just happened to know her medical history, and she would reference her autoimmune issues pretty much at the turn of each visit. She wasn't in here being treated for autoimmunes. And again, I must understate, we're not, quote, treating autoimmunes. We're treating the whole person. We're treating the whole person. But here's the thing, when...
Little disclaimer, right? You gotta put the little disclaimer.
Absolutely. Red lights. But we're treating the whole person. And it has just been my observation, and I can't unsee it, that in the folks I know who have get embarked upon that journey, not just with coming to physical therapy and getting more mobility and movement, but they're doing the work because this is feeding their interest. They're doing the work of cleaning up their diet a bit. They're doing the work of improving their sleep. They're doing the work of managing stress, of letting go of things, of emotional freedom, those kinds of things. In conjunction with those things, the ability to move better and to stand up taller and to be more confident. I have just, all I know is I've seen that happen in this person, and concurrently they've reported improvement with their autoimmune. So again, they didn't come in there for autoimmune treatment. They just came in because they're just tired of being in pain. But if they come out moving better, moving a little more confident, able to do heartwarming things with their family because they developed a little more confidence to do it, then my gosh, let's do this. Let's pursue that. Disclaimers and everything aside, this is just one piece of treating the whole person. In the context of my faith, Jesus Christ is in the business of restoring lives and making things new and healing what needs healing. And you get, in some very, very small way, the opportunity to participate in that just a little bit. With physical therapy. So
that's awesome, man. Man, that's so good. All right, well, I think we're 21 minutes in. I'll do a quick hit question that Jay had from the gym. I happened to say, hey, Chris is coming on the podcast. You got any questions you want me to ask him?
Let's go.
I'll give you the one question that he gave, because I think it's a quick answer. He was wondering about the connection between basically, like, I heard this, is it real that muscle can grow faster than what your ligaments can support? And strength wise.
So actually, I'm sorry, go ahead.
Well, so I just was going to say, I knew from a standpoint of people that use steroids.
They would take growth hormone to support to strengthen up the tendons, so the tendons can support the load that these these steroid induced gains were driving people to do. To have tendon and ligament collateral, they took growth hormone, but when it's all said and done, tendons and ligaments should be responding to stresses in that methodical manner. And like when we strengthen up a muscle, when we strengthen up a movement, make no mistake, it's not just the muscles experiencing hypertrophy and strength. It's the tendons and ligaments that are adapting to those stresses and having having an adaptive response that trains them to be able to perform. Those
so is that, but that's not something that like a normal person that's not using steroids should have to worry about, that they're building muscle faster than what their ligaments can support?
How do I answer that question? Well, no, frankly, I think a lot of that is just getting in trouble with our ego. Have you been?
Do you really
trained,
have the strength?
Have you been trained in this movement? You have to believe. Push yourself further. Push yourself further than you think you can, but in a timely, methodical manner of like 5% increase in load per week if you're going on a cycle or a circuit. So, I think it's more the attempts at loads that, even if the muscles can handle it per se, there's the contractile units in there to perform the movement. If the tendons and ligaments haven't gone through their due diligence of training in order to accommodate that, then you could be setting yourself up for some trouble potentially.
That makes sense.
I hope that answers the question.
Yeah, no, I think it does. Because I think it was like, is that just wives' tales type made up rumor stuff, or is it real? So I think the answer is yes, it's real. But there's also the component of are you using proper form when you're training? Are you training this, like you said, methodically?
And does your nervous system have enough reps
exactly.
in the squat movement pattern to be efficient and confident with this movement? And there's other factors there too, such as the corrective and assistive work, to really strengthen up the tendons. Like Tate presses are one that come to my mind as far as strengthening up the elbows for bench. So yeah, I think the muscles can get a little ahead of the joints, surely the joints. And it just needs to be a methodical, patient process. There's no shortcuts.
Yeah.
Trying to grasp too aggressively at the shortcut can sometimes get you into some trouble. I think everything needs to be methodically loaded. It's all one continuous apparatus. Muscle, tendons, and ligaments need to be loaded in concert with each other.
Interesting. Good stuff. All right, that's our bonus episode. It went 25 minutes, went a little bit longer than I wanted it to, but I think it was all good stuff. So thanks again.
Thank you for having me.
So much fun. I hope to have you back on. I don't have any good reasons why to have you back on yet, but I'm sure something will come up, and I just think this is a connection that we're going to keep building on. So, all right, bonus is over. Love you guys. My 2 cents. Hopefully that all made too much sense.